think really carefully before accepting a diagnosis of testosterone deficiency, and in particular, before accepting treatment for testosterone deficiency. Welcome back to my channel. Thanks for watching. For those of you I've not yet met, I'm Dr. Tom Cordell. I've been a doctor for over 20 years, and with this YouTube channel, I'm on a mission to try and help you sort the nonsense from the truth when it comes to all of the information that is out there about health on social media and online. And in doing that, I want to help you live the longest, healthiest life that you can. So today I want to talk about something which has been on my radar for a little while, but I've only really recently come into possession of proof that it is a big issue. So this is testosterone deficiency and testosterone replacement. Those of you who are a middle-aged man like me will probably have seen your social media feed fill up with adverts for lots of different private clinics offering testosterone testing and treatment for testosterone deficiency. And they'll usually sell it along the lines of, well, you know, if you've got low energy, if you're putting on weight, if you've got less muscle mass, less libido, if you're feeling low or depressed, then it's probably your testosterone that's the problem. And I've always been a little bit skeptical of this because I test testosterone levels a lot in my clinical practice. So whenever a guy comes to me with tiredness or problems with erections or low mood, I'll very often check his testosterone level. But my experience is that although I do a lot of testosterone blood tests, I very rarely pick up anyone with a truly low testosterone. So that begged the question for me, well, how are these clinics making their money? And they obviously are making a lot of money because they're spending an awful lot of money on a really strong social media presence, marketing and website. And I think I know the answer. And so what happened is I got sent over the weekend a screenshot from someone I know because they had had their testosterone checked through one of these online clinics, and they asked me to have a look at the results for them. And what I saw, well, I was really shocked by, to be honest. So if you have a look here at the testosterone levels that this person had measured, you'll see that their total testosterone was 14.5 nanomoles per litre, and their free testosterone, so that's the testosterone, excuse me, that's available for doing its job in the body, was 0.186 nanomoles per litre. Now, those are both reported as being low on this set of results, but that's just simply not true because the British Society of Sexual Medicine produces really good guidelines about how to diagnose and treat testosterone deficiency. And you'll see here on this algorithm that the society says that basically if your free testosterone is above 12, you haven't got testosterone deficiency, full stop. You just don't have it. And if your total testosterone is below 12, then you can then go on to check free testosterone, and if that's below 0.18 nanomoles per litre, then you have got testosterone deficiency. But this person has got a total testosterone of 14.5 nanomoles per litre and a free testosterone of 0.186 nanomoles per litre, both readings of which are normal. So this clinic is telling this guy that his testosterone levels are low, and I would be prepared to bet that their next step is going to be to try and sell him some testosterone replacement. And the problem is I think more and more guys are going for this, and who wouldn't? If you are 45, 50, you're feeling like it's difficult to keep the weight off, you're lacking in energy, you're struggling to exercise, perhaps your libido or erections aren't as good as they were, you're feeling a bit down in the dumps, had some problems with low mood, and someone comes along and says, well, your testosterone levels are low, of course you're feeling like this, have some testosterone replacement and you'll feel a lot better, then why wouldn't you do it? Well, the first reason is that there's a very good chance that it's not going to help you feel any better, because if you've got normal testosterone levels, which this person does, then taking testosterone supplementation is probably not going to help you feel any better. The symptoms you're experiencing are probably due to other health issues, and you'd be much better going and talking to a decent doctor who can run through all that with you and work out what the real problem is, rather than pinning your problems on a supposed deficiency that you don't really have. The other issue, and this is the really important bit, is that once you're taking testosterone supplementation, you cannot stop. What happens when you take testosterone is that it downregulates your body's own testosterone producing mechanisms. And eventually, if you do it for long enough, it can completely stop those testosterone producing mechanisms in the testes, which means that you then won't be able to produce your own natural testosterone at all, or perhaps only in very, very small amounts. And that means that if you stop taking the testosterone supplements, then you're going to feel really rough. You're going to have true symptoms of true testosterone deficiency. And those are symptoms which are exactly the symptoms you were trying to avoid in the first place, but you wouldn't have had anything like as bad if you hadn't taken the testosterone in the first place. So what do I think about this? Well, frankly, I think it's fraud. I think these people should be stopped from doing it. But my advice to you is be really, really circumspect about accepting a diagnosis of testosterone deficiency and accepting treatment for it. And make sure that if you're going to consider testosterone, you've had a proper talk through it with a decent doctor who knows what they're talking about, and that you've looked at the British Society for Sexual Medicine guidelines to double check that your testosterone levels truly are in the deficient bracket. And because if you don't, then you're not going to get any benefit from it. It's going to cost you a lot of money, and you're going to end up not being able to produce your own natural testosterone. I'd really like to hear from you if you have had an experience of these clinics. And if you liked the video, then please do like, subscribe, and tell all your friends about the channel. Take care. Until next time. Bye.